So tonight, what we're going to be talking about is going to be patients first, of course, talking a little bit about our shared goal and our mandate, and really our mandate, which is very well aligned with your mandate as healthcare professionals. We're going to be talking a little bit about patient safety, and we have some good news that we will be also telling you about later on. Regulating public interest, so around the legislative work and some of the updates on that. We're going to be talking a bit about medication safety, the opioid strategy. Folks have been hearing about that, and if everyone's gone to our website, they've probably seen some of the work that's been ongoing in our materials for council. Practice assessments, and then we're going to open it up for questions later on. So, just some housekeeping first. We're going to take about 60 minutes for the presentation, and we're going to have 30 minutes for quality. Oh my goodness, my brain is on quality right now, which is a good thing. But we're going to have about 30 minutes for questions and answers. And there's going to be opportunities afterwards as well to submit questions following the meeting at communications@ocpinfo.com. We're going to ask everyone also to hold their questions to the end. That will give us an opportunity to provide the presentation, largely because it's also webcast, and it'll give us an opportunity to get through everything before we take a lot of the questions. And we will have questions that are in person as well as by telephone and by live web chat. Okay? And we'll be getting Todd to come out and talk to you a little bit later on about what we need to do in terms of managing the questions that are coming on from the phone. So welcome to folks that are on webcast and also on the phone as well. So let's get started. First of all, I want to talk a little bit about patients first and really our shared goal. And the mandate of the college, as folks know, is to serve and protect the public. And I always say, you know, that's also the mandate of all healthcare professionals. And when we take a look at serving and protect the public, oftentimes folks figure, oh, you know, it's the college. They're here to keep an eye on us. They're here to watch us. But honestly, when we think about it, we're here for you because, and we're here for the public because when we take a look at what professionals do, their role also is to have the same mandate as us to serve and protect the public, as they are your patients. Our vision, there we go. I guess our vision is to lead the advancement of pharmacy to optimize health and wellness through patient-centered care, and we talked a little bit about our mandate. So tonight, our first piece is around partnering. And as a college, of course, a lot of the work that we do has to do with partnering. We recognize that there's a need for us to be working across the board and with a lot of our partners. So here you're seeing a number of the types of partners that we do work with, including the associations, including government, including patient groups, a lot more now than we have historically in the past, and also as, I guess, healthcare professionals. We are now working in government and regulatory a lot more with patient groups than we have in the past. So as we're moving forward, of course, this is very, very important that we get their voice into all of the work that we do as well. We also work a lot with academics, and we have research that comes into all of the work we do. You'll hear a lot about evidence over the next little while, and today as well, through our talk, we'll be talking a lot about evidence and how we need to use that to drive all of our decision making as well. So over the next little while, you're going to see a lot around the evidence that we have been collecting that's helping us to do that. So there's absolutely a need for us to work together as healthcare professionals, pharmacists, pharmacy technicians, as well as the college in that shared mandate to serve and protect the public. A little bit about the difference between a regulatory body and an association. Oftentimes we get a lot of questions from folks and they're trying to understand certain things and they don't know oftentimes who they need to go to around these various questions. And we'll get questions around business, and really when with the mandate that we have, it's really not our place to have those discussions around business. And so just want to take a minute here and talk a little bit about the differences. As a regulatory body, our mandate is public protection, and that's established in legislation. An advocacy body furthers the interests of its membership. That's its job. When you take a look at the regulatory body, of course, the membership is required. And it's really a licensure or a registration when it comes to the regulatory body. In order to practice, you require licensing. Whereas an association membership is actually voluntary, so you can join or you cannot join. Obviously, if they have the interest of the membership at heart, it makes sense maybe for pharmacists and pharmacy technicians to join. However, that's the difference between the two. We are accountable to the public and to the government, whereas an association is always going to be accountable to its membership and to its own board. So examples of, for example, the flu shot, the role of the regulatory agency is really to make sure that folks are going to be getting the flu shot with all of the information and the competency that's necessary to provide it safely to folks, to public. Whereas if you take a look at an association, their job would be to advocate for getting the flu shot as one of the things around the scope of practice, and they would be doing things like advocating for payment for the flu shot as well. So a little bit of difference there. The other thing I just want to talk about a little bit is around the confusion that often happens because our council members are elected. Right, so oftentimes members think that, well, the council member is there to represent me. They're not. They're there to represent the constituency within your area. So you may be voting for them, you may be electing them, but you're electing them to keep your public safe and to serve and protect your public. So sometimes what happens is it causes confusion, and we just wanted to clarify a little bit about that. Speaking about the public, what is the role of the public and patients? So I want to talk a little bit right now about some of the things that are going on that people are probably seeing a lot of in the news, in the media. And there's been a huge discussion around erosion of public trust in the regulated health professions. And I want to mention to you that it is a privilege to have a regulated health profession. To have the opportunity to regulate ourselves really is a privilege. And when we look across the entire world, Canada is the last country that truly has self-regulation. Every other country around the world has some form of it, but largely has gone back to government regulating the professions. And so when we think about that and the privilege that it is to serve and protect the public and the responsibility and the accountability that comes with it as a profession, it's really important for us all to be working together to protect that. We hear a lot of things going on in the news. We hear things about the various colleges, regulated health professions colleges, and there's 26 of them here in Ontario. And when you see some of these things that are going on, it makes you ask some questions. And as a result of the things that have been going on, that's why we ended up with the chemo underdosing and all of that stuff that hit the news. And we took it on. The college took it on, and we now have oversight of hospitals as a result of that. But a different thing could have happened. The government could have decided, oh my goodness, you guys don't know what you're doing anymore, and therefore we're going to take it back. That was their option. And then you have things that will happen like the Sexual Abuse Task Force. And now we have the Protecting Patients Act, which has now become law. And Anne's going to be talking a little bit about that later. But when you see all of these things going on, and really a lot of it is around putting more and more controls in place. And as a regulated health profession, we always have to keep in mind that it is a privilege to serve and protect the public. It's a privilege for all of us to have the opportunity to self-regulate. And we need to really keep that in mind as we're moving forward. But what it means is that as we go forward, we have to make sure that every step that we take, the things that we do as a profession, makes sense for the public. And it brings us back to this whole bit around patients first. When you take a look at the government and what they've been talking about is around access, inform, protect, and I lost the last one. I'm looking at Todd here. But anyways, what happens though, of course, is the government has a direction. And when you take a look at what we have to do as healthcare professionals, what is that? What is our role, right? And our role really has to do with protect, our role has to do with access, and our role has to do with informing, which means transparency, right? How do you keep the public informed of what it is that you are doing? And you'll see a lot of work that's gone on here at our college, as well as, I would say, across the entire province around transparency, right? So we are increasing public input also into all of the work that we do. Anne's going to talk a little bit about patient safety. Susan's going to talk a little bit about the opioid task force and some of the work that's gone on there, and the cannabis work. And in all of these groups now, we are having more and more public members sitting on these working groups to allow us to move to a better place, to be able to go out there and understand from their perspective and their voice what they feel is necessary. Right? Oftentimes as professionals, and I would say this, historically, healthcare professionals, whether it be in pharmacy or any other professional, oftentimes we look at things from our own perspective. And it is only when you put that patient right in there and you ask them to give their perspective, how did they feel? What if it was your mom? What if it was your kid? How would you feel? Right? And looking at it from that perspective allows us to come up with a better strategy and a better way forward because we're acting on their behalf. And what it's done is it's been helpful. I'm thinking back right now to the work that was done, that I did way back in the government on the Mental Health and Addictions Task Force, and the work that was done there. Well, we had patient groups, persons with lived experience, a whole group of them that helped us to move things forward. A lot of the work at the Local Health Integration Network was the same, a lot of patient groups. And now, as we are moving forward, we are also taking patients and putting them right on to our working groups so we can come up with a better process.